feel like still what we mostly do intervention-wise is try to give young people the skills to either, mindfulness or problem solve, or so that they can cope better, or we try to treat the individual. And I feel like we're still not doing very much to try and sort of fix the world that is making us ill, rather than just fixing the people when they get ill. And we don't understand what the sort of macro trends are that are influencing these things, right? Because if you think about the things that in terms of health we've historically studied, such as, infection, child mortality, poverty, arguably all of those things have been getting better over the last century. But in that context, the fact that people's mental health, and especially young people's mental health, is getting worse is interesting, and I think still poorly understood. So yes, lots of effort to sort of help young people when they get ill, but still not very much to try and understand why so many young people are struggling. Nobody funds the research to look at poor housing and food, right? So as you were saying earlier, lots more funding for looking at the nuances of social media use and things, which is great, but nothing still to look at any of the other social macro things that probably matter to lots of people. So I would argue that yes, I mean, any field probably moves forward in any 15-year period, and your observation that we're doing more interesting, more nuanced things is probably true, but still lots of things that probably matter that nobody is funding. And because nobody's funding, there's less scope to look at. Lots of the work we do and we have done in this program has been finding large existing data sets. And the big advantages of these are you would never be able to collect this type of data in a project like this. Lots of them span decades following the same people, which you wouldn't be able to do. They cost millions to collect well. Lots of people have spent time, effort, and energy to collect these data. And they're there for the research community to use. And so we're just trying to do a workshop to show people examples of how these can be used. I think there is an ethical problem here as well. Like, if all this data exists and is super rich, and you could answer the question you really want to answer by going and using one of these instead of collecting all the data from scratch, isn't it better both in terms of people time, resource burden, all of this, to do that instead of trying to collect the data from scratch? So I think it's a waste of research resources that have already been generated and people's time and participant time who've contributed to these studies if we just keep trying to collect the data and reinvent the wheel when the data usually exists somewhere, if you just bother to look.